Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Greetings, everybody. Welcome back to another episode of Black Health, brought to you by the Health Foundation of South Florida. I am your host, Dr. Michelle Kirwan Blythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. Today, we're talking about gastric cancer awareness and health equity with Brittnay Starks, Communications Director for Debbie's Dream Foundation for Curing Stomach Cancer, and Aisha McDonald, licensed mental health counselor, certified trauma expert, director of training for United Way of Broward County, and board member for Debbie's Dream Foundation. Ladies, welcome to Black Health. Thank you, Brittnay, for coming back again. And Aisha, welcome to Black Health. I know it's your first time on the show. Let me give you guys a quick moment to introduce yourselves and what you do, and tell us a little bit about Debbie's Dream Foundation.
So I am a Miami native, born and raised. I am the daughter of a cosmetologist, and at an early age, my mother planted a seed for a service. She had clients that would lose their hair, many from cancer treatments. And so we got involved with the Women's Cancer Association at the University of Miami when I was 19. I was one of the only Black and youngest board member, and went to University of Miami, got a master's degree in communications and public relations. And then fast forward in 2017, I met Debbie, who's the founder of this organization. She hired me, and she was the only person I ever met who had gastric cancer or knew of with gastric cancer. And I'll talk a little bit more about it, but I want to give Aisha a chance to introduce herself.
Good morning. So I am a licensed mental health counselor and just have worked with a range of clients in different systems, just going through so many of what they go through. And one of the things that stood out to me was just the social and community barriers that marginalized communities face when going through different health circumstances. I come from a family of cancer inheritance, is what I call it. I have family members on both sides that have been diagnosed with a wide range of different types of cancer. And I had the opportunity 2 years ago to go to Debbie's Advocacy Day to talk to Congress about just how we're funding research regarding this. And it really just stuck with me, and they kept me and I kept them. And now I'm a board member.
I love to hear these stories. It's amazing. It's usually personal experience that gets people involved in something. So we're talking about gastric cancer. For those that are watching that might not be aware what the word gastric means, what is gastric cancer? Where do you find it?
Gastric cancer is your stomach. It's the middle part of your abdomen, just below your ribs. It's the part of your body that breaks down food when you eat. And gastric cancer is the forming of cells in your stomach. And it could start in any part of your stomach, and it can also affect your throat area as well. So, and that would be gastric esophageal juncture.
What are some of the common signs and symptoms of gastric cancer that people should be aware of?
So common signs and symptoms look like heartburn, indigestion, gastritis, weight loss, nausea, some stomach pain, which are very vague symptoms, making it very sometimes hard to diagnose. But if you have these symptoms and they persist, definitely you want to get that looked into.
Yeah, and I think that's the key, persist, because like you said, they are very vague symptoms, and we may send a bunch of people running calling their doctor now, I think I have gastric cancer. So persist. And I think the weight loss is a big one as well, because with just heartburn, you should not be losing weight. What are some of the known risk factors, and are there any that disproportionately impact the Black community?
So known risk factors are genetics, family history. You also have H. pylori bacterial infection, which lots of research have come out about how it contributes to gastric cancer. Diet, if you have a diet that's high in salt, preserved foods, anything that's like pickled or smoked, which we know coming from the African American community, that's a good portion of our soul food, right? And so those kind of risk factors put us at a higher risk for things like gastric cancer. And Aisha, I don't know if you want to touch on that.
I think it's just being aware of like the cultural elements that can impact our health. And a lot of us just take things for granted because culturally we eat a certain way, we live a certain way, we grow a certain way, and we have very little awareness most of the time for how that can impact our good health and our bad health, because that's really just or norm and what we've been socialized to become used to. And so, being Caribbean, I am very mindful of the fact that a lot of our health recipes aren't necessarily going to coincide with having good health. And it's interesting because I myself, knowing this intellectually, I still argue when my doctor brings up points of things I need to leave out of my diet. And I'm like, that's not going to happen. I'm Korean. It's just how we eat. But just being mindful of how it impacts us in the long run is always essential.
I'm Caribbean as well, and I always hear Caribbean people say a meal is not a meal without some rice and peas, and I have to agree.
The main thing my doctor tells me to leave out, and I'm like, I'm Caribbean, my husband is Latino, rice is never leaving our house. But
we do have to watch what we eat, and I think being mindful of how much we're eating of something, like everything in moderation, I guess.
Absolutely.
To some extent. So how is gastric cancer screened for and diagnosed? And why is early detection so important?
So gastric cancer is typically found through a procedure called an endoscopy or an endoscopy. It's where they take a tubular camera of sorts and go down the throat and stomach juncture to be able to see if there's any cells that are forming or polyps that are forming. That's the typical way to diagnose it. I would say that preventative wise, it's not really detected in any other way, which is why it often gets misdiagnosed. We have patients that come to us who have been diagnosed with chronic gastritis or, just chronic acid reflux. And if there's no endoscopy to confirm, it's kind of hard to tell. And so we find it late stage, unfortunately.
How common is gastric cancer? Do you have any statistics on it? And what about for Black people, people of African descent, Caribbean?
So gastric cancer, about 27,000 Americans will be diagnosed this year, and about 11,000 will die from gastric cancer. Now, as it relates to African-American population, for African-American men, they're twice as likely to be diagnosed with gastric cancer than their non-white Hispanic counterparts. And African-American women are a similar statistic, with more than twice as likely to be diagnosed than their non-white Hispanic counterparts, and twice as likely to die for both male and female when it comes to African Americans. So.
Studies have shown that Black patients often face worse outcomes in various types of cancer, including gastric cancer. Are there some reasons behind these disparities?
Absolutely. One of the biggest issues for us is the delayed diagnoses because of lack of access to quality healthcare, which is a very big issue that is prevalent for lots of demographics that have been marginalized and historically oppressed. The mistrust of the healthcare system is also significant, given just systemically and historically things that we've experienced that lets us it leaves us a little apprehensive of wanting to connect and wanting to seek care, because we're not quite sure if the care we get will be culturally relevant, if it will be racially appropriate, and if the patient and provider relationship will be one that is going to be meaningful in us being able to get good health.
Mm-hmm. Ladies, we do need to take a quick commercial break. Black Health is brought to you by the Health Foundation of South Florida. And today we are talking about gastric cancer with Brittnay Starks and Aisha McDonald of Debbie's Dream Foundation. We will be right back.
Rosie Cordero Stutz' past behavior is troubling. Rosie defied a judge's order and refused to show up to court. A judge sentenced Rosie Cordero Stutz to 7 days in county jail. Rosie disregarding orders, failing to follow the law. Reject Rosie Cordero Stutz and her dangerous ways.
We're made, surrounded, and thrown into it, fed, energized, and supported by it. Water makes everything possible, from the very firsts to the everyday, during the make or breaks, or after lazy days, for the dreams come true, and everything in between. Because water is life.
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
Voting yes means hundreds of new jobs, $15 million in affordable housing investments, and a new public park for all residents. Join community leaders in voting yes for Watson Island Park number 292 by November 5th.
You're watching Black Health. Welcome back. We are with Brittnay Starks and Aisha McDonald of Debbie's Dream Foundation talking about gastric cancer awareness and health equity. And we were talking about how gastric cancer disproportionately affects Black people. What role does socioeconomic status and access to healthcare play in these outcomes?
Well, when we think about socioeconomic status, we think about overall social determinants of health and how the non-medical factors in our life can really impact our health outcomes. And when it comes to our income level and our access to healthcare, the two things are directly correlated. I am more likely to have quality healthcare if I have money and a financial stability. Whereas, with those of us who may be in lower socioeconomic background, then the quality of care we receive may not be inclined to lead us towards the specialists who can detect these type of things. Even our social context and the built environments that we live in, where's the accessibility? Where are the centers? Where are the hospitals? Where are the specialists and where are they located? What does transportation look like? What are the hours that they work and what are the hours I have to work? Because if this facility is only open from 9 to 5 and I work an hourly job from 9 to 5, that I have to use public transportation to get to, I am less likely to be meeting those appointments because taking the bus for an hour and a half and missing work for 2 to 3 hours means that my income will be lessened. And I have bills to pay and things to take care of and obligations to my life and my family. And so that is a huge issue that arises with people's access to healthcare because we may have access, but is it quality healthcare and is it relevant to our needs?
Mm-hmm. Education is so important when it comes to illness, health disparities, and why these disparities exist. And I know you all have an upcoming educational symposium this is through Debbie's Dream Foundation, correct?
Yes.
And I don't know that we touched on Debbie's Dream. How did that come about? How did the foundation come about? And then tell us a little bit about this upcoming symposium.
Perfect. So Debbie's Dream Foundation was founded in 2009 by Debbie Zellman, who was a practicing attorney, a wife, and a mother of 3 young kids at the time that she was diagnosed with stage 4 incurable stomach cancer. She was given about 4% chance to live beyond 5 years and really told that she had about 6 months. And to know Debbie is to know that she didn't take bad news lying down. She took it upon herself to create this foundation in 2009. And it was basically her answer to not being able to find resources. She couldn't Google stomach cancer and find anything that would help her. And to be told you're going to die from something that you can't learn about from a Google search is daunting. So Debbie's Dream Foundation, we provide resources and support to patients and families. We help raise awareness. We advocate for federal funding and also raise funds to fund cancer research directly. And we are very passionate about helping find a cure for this disease. And so Debbie's Dream Foundation is your one-stop shop. If you or someone you know is affected by gastric cancer, we are a strong and resilient community. You will feel supported. You will see reflections of your journey, and you will know that we are the place and a community that understands.
And the symposium?
The symposium is November 9th. It's helping us kick off Gastric Cancer Awareness Month. We will have panelists who will speak on different topics, medical experts who will cover treatment options, things like body dysmorphia and mental health, which are topics that don't really get a lot of attention when someone is diagnosed with cancer. We'll also have patients and caregivers who will be part moderators and also leading the conversation. So if anyone is interested in learning about gastric cancer, different topics that affect those who are affected by gastric cancer, please come out. And then following that event later in the evening, we will have our illumination ceremony and celebration dinner. And that is an opportunity to participate in a global event where we light up different monuments in shades of periwinkle in honor of Gastric Cancer Awareness Month. We'll also be highlighting some of our luminaries. We have 3 people that we're acknowledging: Dr. Valerie O'Brien, who did research with a gastric cancer grant from Debbie's Dream Foundation. And it basically uncovered that H. pylori has some contribution to gastric cancer. And then there is Dr. Samuel Clinton, who's a SMAB member of ours. He's a scientific board member, and he educates our community. And he's a real advocate for health literacy and making sure that patients understand their treatment options. He also did a clinical trial that some people in our community benefited from. And then Jonathan Porter is a Naval and Marine Corpsman who got gastric cancer after having H. pylori. 5 years after being treated for H. pylori, he developed stage 4 gastric cancer, had a total gastrectomy, but he's been very inspirational to people in our community. We actually helped use some of his story in our letter to the Senate to help get a bill passed for H. pylori to be screened for armed servicemen and women, early screening for armed servicemen and women for H. pylori. So that's going to be our evening, and you'll be amongst others in the community. It's a great way to celebrate gastric cancer awareness and help raise funds for research.
And just tell the audience again when it is, the date and time, and how they can get tickets or RSVP for it.
Yes, so both events are November 9th. It will be held at the Hard Rock Hotel and Casino in Hollywood, Florida. And you can get tickets on our website at debbiesdream.org. You can also find opportunities to volunteer, reach out to our team. And both events are in honor of Gastric Cancer Awareness Month. So it's a great way to kick off celebrating the month, learning as much as you can learn, and then helping spread the word.
Wonderful. I understand your organization is involved in health equity initiatives. Can you tell us some of the specific programs or efforts that you're working on to improve health outcomes?
So one of the first connections and collaborations we were able to do was through a health equity program that United Way has been hosting for a number of years. And thankfully, Debbie's Dream Foundation was one of our first community partners in this. It is a health equity training program that is actually a consortium of partners that is funded by the Florida Blue Foundation. The United Way of Broward County partners with Moffitt Cancer Center, as well as Orlando Health. And we actually created and developed a health equity training that is geared towards giving providers applicable skills to deal with a different range of demographics and their needs, while also teaching and educating them about how the social determinants of health impacts individuals' healthcare access and quality. And Debbie trained all their staff, I believe, in this. And through that collaboration, we were able to form further community connections for a wide range of events that I'll have Brittnay tell you more on.
Yes. So we work with the United Way. They do their Mission United Turkey giveaway for veterans. We help support that initiative. We also work with the YMCA. We've done some of their community workshops, their Stitch Holiday on Stitch coming up in December. And then we have worked with Deerfield Beach Community Cares, serving dinner to local community and helping to educate them about gastric cancer. So we're always trying to find opportunities to show up in the communities that are disproportionately affected, Black and brown people, namely, and meet them where they are, because that's the biggest issue is access. Right? If the information is not there, they don't know. And a lot of times, depending on their social determinants and social economic situations, they're not traveling outside of their communities as much. So Debbie's Dream Foundation, through our training, we've learned that we have to meet the community members where they are. And also not just that, but also health literacy, making sure they understand the information, which has been a big barrier across the board for healthcare in general. But we try to make sure that the information is understandable. We work with medical experts to make sure that when they're sharing this highly scientific information, it's not intimidating, that people can understand what they're listening to, what they're reading, and they can go back feeling empowered to talk to their healthcare providers about their concerns.
It is time for another commercial break, ladies. So we're going to take a moment, quick break. You're watching Black Health, brought to you by the Health Foundation of South Florida. We're talking about gastric cancer awareness. We will be right back.
I am Wanda Jenkins, and I am a breast cancer survivor. I didn't feel a lump at all. It was just a routine mammogram. It's so true. If you don't go, you're not gonna know. I was just like, no, I gotta beat this thing. I'm winning, and then I'm gonna someday tell my story, and here I am. The doctors and the nurses at Baptist Health Cancer Care, they're going to be there with you and for you 100%.
We're made, surrounded, and thrown into it, fed, energized, and supported by it. Water makes everything possible, from the very firsts to the everyday, during the make or breaks, or after lazy days, for the dreams come true, and everything in between. Because water is life.
I'm Sheriff Morris Young. Illicit marijuana laced with illegal drugs like fentanyl have destroyed lives. I know, because I've seen it firsthand. Amendment 3 will save lives by making marijuana safe, regulated, and lab tested. Amendment 3 will protect our community from dangerous illegal drugs while allowing law enforcement to focus on serious crimes. Vote yes on Amendment 3, the smarter and safer choice for Florida.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health, with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehealth.com today.
Welcome back. You're watching Black Health, brought to you by the Health Foundation of South Florida. And we're talking about gastric cancer with some ladies from Debbie's Dream Foundation. So ladies, what we haven't touched on is treatment. What options are available for someone that's diagnosed with gastric cancer? And are these treatments accessible in underserved communities?
So treatment options are your typical options for cancer: chemotherapy, high-PEC, PIPEC, which is like a heated chemo, immunotherapy, which some of it is coming through breakthrough clinical trials. And also there is the option of having your stomach completely removed if you are in a position to do so. We have patients that have partial and total gastrectomies, but that in and of itself comes with a whole nother set of complications that many of our patients in the community have to grow through, in a sense. And so Aisha can probably talk to, access a little bit more.
I think one of the most meaningful things that I've seen Debbie's Dream Foundation do is open up the access for the initial testing. They're now offering endoscopies, or at least financing endoscopies for individuals who don't have insurance and wouldn't be able to otherwise get this check. And we know that with a lot of the individuals in our communities and our certain demographics having delayed diagnoses, it is so important that they're getting early intervention and getting tested appropriately so that we can really determine what is the root cause of the issues that they're having. So Debbie offers, for those individuals who may be seeing those symptoms we talked about earlier and aren't sure what's really going on, without insurance, they really have no ability to know further. Debbie offers to finance those endoscopies for them so that we can really make that determination and then see what type of element of treatment is needed further on.
We are coming towards the end of our show, so I would like to give you both an opportunity to just give your key message to our listeners today when it comes to gastric cancer awareness and the importance of education, early detection, and community involvement, really.
Don't be afraid to advocate for yourself. And also learn about the resources that are available. A lot of times doctors don't know what to tell patients because there's not a whole lot of information about gastric cancer, but places like Debbie's Dream Foundation, we built a community of not only patients and caregivers, but also experts. So this is the right place to find if you are someone you know is affected by gastric cancer. Check us out on our website, www.debbiesdream.org, to learn more about what we have to offer and our upcoming initiatives and events.
I think for me, the most important part, I am a trainer now for healthcare professionals and behavioral health providers. And as a clinician who works in direct service, I think it is imperative that as the providers and the professionals, how are we making sure that we're providing equitable care to minimize the disparities that people are feeling? And while Debbie speaks directly to those impacted by it, I am grateful that they also speak to the healthcare professionals about how are you making sure that you're providing relevant care, culturally sensitive care, and meeting individuals on levels that they can really understand. I told somebody once, I have 3 college degrees, and sometimes when doctors talk, I don't understand a thing they're saying. I'm just like, hold on, let me open my Google search so I can Google what you're telling me. And being mindful of that, especially here in South Florida, with such a large immigrant community, there's cultural differences, there's language deficits for some individuals. And so how can we make sure that we're providing care equitably, but also respecting people's backgrounds, respecting their culture, respecting why somebody doesn't want to change their diet because that's all the food they have access to. So how can we guide them to make better choices while being mindful of, where they're coming from?
And on that note, we have come to the end of our show. It always goes by so quickly. Thank you, Ms. Starks, Ms. McDonald, for your knowledge, your information, your passion about gastric cancer, the dedication that you put towards it. I know that you're saving lives and changing lives. So thank you for what you do. Thank you for all of you that are watching Black Health. We appreciate your support. I am Dr. Michelle Kirwan-Bythewood. You can follow me on Black Health Show on IG. And these ladies, one quick plug for Debbie's Dream Foundation. How do they find you?
You can find us at www.debbiesdream.org and on social media platforms at Debbie's Dream Foundation.
Well, thank you everybody for watching Black Health. We'll see you next time.
This year, we can elect Commissioner David Richardson as tax collector, a certified public accountant who has dedicated his career to fighting fraud, waste, and abuse. David Richardson will lead with integrity. As tax collector, Richardson will improve customer service and enhance programs for residents.